Good evening, everyone. My name is Jonathan Landsman. I'm our board chair, and this is our monthly general board meeting. Um, Following the agenda, what I'm doing right now is calling us to order. Next, I'll stand and we'll do the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Next, Sheila, if you could, roll call.
Mr. Young? Mr. Furman?
Present.
Mr. Cowan?
Present.
Mr. Torres?
Here.
Dr. Hahn?
Here.
Ms. Newman?
Present.
Ms. Root? Here. Ms. May? Here. Ms. Woodruff?
Here.
Dr. Giles? Pastor Jones?
Here.
Mr. Landsman?
Here. And I see we have a quorum.
You have a quorum.
Okay. Next on the agenda is a request from the board for a motion to approve the agenda.
So moved.
Thank you, John. Who would support? Thank you, Pastor. Is there any discussion? Hearing none, all those in favor of approving the motion to approve the agenda, say aye.
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 Any opposed? Motion carries. Next up on our agenda is public comment. If there is anyone that would like to have public comment, as you know, we offer 5 minutes. It's for the topics that are in line with MDHHS, with the county, with us. Is there anyone in the building? Is there anyone remote that wants to make public comment?
We do have one individual that submitted for public comment, Deckard Kane. If you are on the call, please unmute yourself to state your public comment. Just another reminder that you are allotted 5 minutes to share your statement. Individuals who do provide public comment are asked to discuss OCHN business, legislative matters, and MDHHS advocacy issues only. Another reminder that we request you to refrain from using slander, profanity, or ethnic slurs. Thank you.
Are they still on mute? Okay. Well, there will be a second opportunity to make for doing public comment later on in the meeting. So if you're interested, please either be here or register, and we look forward to those opportunities. Thank you. And now we'll move on with topic number 2, which is the financial audit. So this is presented by Patrick Franklin, Eddie Brown, from the BDO audit team. You guys have the floor.
So I said Eddie Brown will be joining us, and probably during the presentation. He went back upstairs to grab something, but I'm introducing our auditor from BDO Services. He's going to come with the update.
All right, good evening, everyone. Thanks for having me. My name's Jason Kelly. I'm Audit Senior Manager with BDO. and we're here tonight to present our audit results for the fiscal year 9/30/2022. Today, we're going to go over some of the draft financial results and then talk about some of the other reports that we will be issuing as part of the audit, and then have time for some questions at the end, should the board have any for me. Just me and my contact email, should you want to reach out with any questions that come up after the meeting is done tonight. Financial highlights. From a high level, the authority ended with a total net position, or assets in excess of liabilities, of just over $61 million this year. That was a decrease of about $10.8 million from fiscal year 2021 end. Long-term debt payable is at $6.5 million as of September 30th, 2022, and that's a reduction of $960,000 from the previous fiscal year. Forward one slide, please. So here we have a comparative summary, a statement of net position, or your balance sheet. And if we look at the top section, we can see total assets closed out at just over $142 million this year, which is a decrease from the previous year of $166 million. And most of that is in the current and other assets bucket. Similar, total liabilities ended at $75.6 million, which was a decrease from the prior year of $87.9 million. The big swing there is also in the other liabilities, or the current liabilities section, and that is largely due to the year-end cost settlement process with the providers and the state, and how the year ended up regarding the due from providers and or the state of Michigan. So that's where you see the swing in the current assets and current liabilities. And then the bottom section down below, we can see the $61 million in net position. So of that, $17.7 million is the net investment in capital assets. So the authority's total capital assets, building, fixtures, equipment, less any of the debt outstanding on those assets. And then you have restricted for certain programs, certain grant funds that come in are restricted, must be spent on restricted activities. So we show that amount of $19.3 million as restricted. And then finally, the unrestricted net position is just shy of $24 million at the end of current. We can move ahead one. Thank you. So here we have a summary income statement, or changes in net position. And if we look at the total operating revenues, we can see an increase there of approximately $48 million. There's two main reasons for the increase this year. One is there's a new funding, the CCBHC funding for fiscal year 22, that made up $22.8 million. And then the rest is largely in the Medicaid capitated revenue and the grant revenue. So the capitation rates and the services provided to Medicaid eligible consumers of the authority increased, therefore the revenue increased. And then we'll see a corresponding increase in the expenses down below due to the cost of providing those services. Please. So here we just have a summary of the capital assets by category, and then we show the net amount there of the $24.3 million. So the $7 million of outstanding debt gets us down to the $17 million I mentioned earlier for the net position that's invested in capital assets. Please. And then long-term obligations. So there's two outstanding debts there, and we can see they did reduce by the payments this year of approximately $960,000 as previously stated. So then also as part of our audit, we perform what's called a single audit as required by the Uniform Guidance, or Title II U.S. Code of Federal Regulations there, where we're required to look at the federal expenditures of the authority and select major programs based on the size of the program, and we also look at the compliance of those major programs to issue opinions or report any noncompliance, and I'm pleased to report, as of today, we have not identified any noncompliance with the federal awards. We're not anticipating to be reporting any noncompliance issues. And then the compliance examination, that's required by MDHHS every year. So they have certain compliance requirements in their guidelines that they give us, and we look at the compliance for MDHHS and also issue a report to the state for that. And we are not expecting to report any noncompliance at this point in the compliance examination either. And then the final document that we'll issue is a management letter. That's our audit wrap-up communications, required communications to the board under generally accepted auditing standards. And in there, we discuss our audit approach, the type of opinion that we will issue on the financial statements, whether we had any internal control findings, deficiencies, which we are not expecting to report any deficiencies or findings at this point, along with the statement that as independent auditors, we are independent of the authority and we remain independent from any management decisions and other ethical responsibilities that were required. And then finally, I believe the next slide is just a big question mark, if anybody had any questions for me this evening.
Go ahead.
Yeah, just a general kind of question. So, as you probably know, because of we're coming out of the post-COVID, we're in the post-COVID era now, and some funding sources are going to change in terms of not as much money as we've had in the past. We've got the Medicaid re-enrollment that's going on. Just based on your general knowledge with the funding sources and things of that, what should we be looking at preparing into the future as we try to plan for that eventuality of a decrease in revenue, some revenue sources?
So as I stated, the net position earlier, the 61 million, that's at the end of fiscal 22, that's a healthy net position number currently. As far as going forward, that's really a management decision through the budgeting and forecasting process. As auditors, we're obviously looking more at what has happened and not predicting what's to come. So it's really tough for us to speak and make any, assumption as to what may happen in the future.
Okay, that's fair.
I had a couple of questions. Thank you for answering all the questions that we submitted, just to help the board out.
Oh, no problem.
Trying to help them understand what is the scope, how do you approach things, et cetera. So a couple of questions I had, and it's good to hear that based on what you've seen, although you said so far, the way you said it, that controls seem to be okay. There's no comments, there's nothing that has to be remediated from a process perspective. I'm assuming that that's what your message was.
Yes, and we are substantially through our audit work. We're in our final quality review process, so we have to caveat at this point, right, just in case something were to come up throughout that final review process. But from what I have seen, I'm not expecting, we have not come across any entries that we had to propose to management to adjust anything on the books or records.
Okay. Do you guys, does your audit team have access to our financials to pull data, or is that provided upon request by the finance team?
That's all provided by request of the finance team. We get the download of the detail, and then we request, based on our sampling and our risk assessment, support for certain transactions that we sample, and then they provide the underlying support to us.
Okay. I'm going to ask it a different way. So was that a dump of all the detail, and then you did your own sampling, or did you ask them to provide like a 10% sample of the data and just they gave you the 10%?
We get a dump of the entire detail,
Okay.
create the population ourselves from the detail, and then do the sampling ourselves, yes.
Okay, thanks. I'm an ex-auditor. I was a senior audit manager for Arthur Anderson 20-some years ago.
Yeah, it's been a while since they were around, right?
Yes. I didn't cause them to fail. So it sounds like things are good. It sounds like the implementation of the new software, it's got strong controls in it. So, from what you guys could test.
Yeah, so the new software went live on 10/1 of 2022, so fiscal year 2023. So all the detail we received was out of the old software. So our IS team will look at the implementation and the transfer from Great Plains to Business Central as part of the fiscal year 23 audit. But since all the detail for fiscal 22 was in the old system, the new system didn't really have any bearing on the audit for fiscal year 22.
Okay. Thank you. Other board members that may have questions? Yes, John Paul.
So, in looking over the information that's provided, so we had a decrease of $10.9 million for the 2021-2022 year, correct?
Correct, yes, in the net position, yeah.
Okay. And then how much was the cost settlement from 2021? So I believe I
Eddie, do you have that handy?
reading a cost settlement, correct? Or for the fiscal year that was audited?
So for the physical year of FY '22, our net cost settlement effect between whether the providers owe us or whether we owe the providers was a decrease of $10.5 million.
So that's what it was? It was 10.5?
10.8, I think, 10.8.
Yeah, 10.8.
Okay. And so, could you explain just in layman terms what a cost settlement is?
So it is a process that the budget and finance team, that includes the accountants as well as the cost utilization team, where at year end, after doing pretty much all of our payout or the expenditures for the year, we do a true up of saying, okay, how much of the dollars that we pushed out to you did you truly spend, and whether we're going to make you whole or do you owe us funds back for that process or services.
Okay. So we owed, correct?
Correct.
Okay. And it was 10.5?
10.8.
10.8? Okay. And then what was our operating revenue?
$443 million.
Right, okay. So there was a decrease, right, by $9.4 million roughly?
No, it was an increase in revenue.
Oh, there was a increase in operating revenue, I'm
Correct.
sorry, okay. So then the increase was was it 9.4 million, what was the increase?
I don't. Roughly 40, yeah.
It was from 41.8 to 48.2, is that correct?
No, I'm looking at 395 million, to 443 million.
Correct. To 395 million to 443 million.
So roughly $48 million.
Yeah, so that's what I was saying, yeah, the 48 million, okay, that makes sense. So our revenues went up, but our expenses went up even more though, correct?
Correct.
Yes.
Thank you.
Oh, now it's on.
Yeah.
Okay. So, Eddie, regarding the cost settlements, so from what we were trying to understand is there was a change in the cost settlements, and we're trying to get our hands around it, and I guess if we hear it enough times, it'll make sense even to me, what went on and the timing and all that.
There was a change in a total that was recorded prior to our auditors being, actually starting their process of where some premium pay totals to a particular provider were not captured. And so that caused the cost settlement total to increase.
How did we miss that, or did they have new charges?
I can't really speak to the specifics of how that oversight might have happened, but we are, working diligently to strengthen our controls and processes of how we do things going forward.
Other questions from board members? Yes, Christina?
So I'm looking at the Medicaid risk reserve. Was that decreased in 2022 as part of the cost settlement?
Do you want me?
Just making sure.
So, no, the decrease in the risk reserve was allotted carryover funds from FY21, and due to our ending FSR that we presented to the state, there was a deficit in certain categories, and so that risk reserve funds was allotted to move to help cover some of that deficit.
Okay, thank you.
So kind of a follow-up on that, is there, I think I saw in fiscal 2021, we had that reserve, but this year we don't.
Correct. That is
Okay,
correct.
good, I was reading it correctly. So along those same lines, were fiscal 20 and 21, because of nobody falling off Medicaid, I'll say it this way, artificially high in terms of the numbers? I mean, we were dropping 9.1 and 16.2 positive change, which seems pretty good, pretty high.
Right,
But
correct.
is that artificial because nobody was coming off? And if you look back 19, 18, 17, were those years 2, 3, 4, 5 million, or okay, so 16.2 was extremely high.
Yeah.
Okay.
So just as you alluded to, the health emergency was in place during that time, and so our enrollee is significantly high right now. But
Okay.
yeah.
All right, I'm just trying to get a frame over a longer time period. Thank you.
Yes.
Other questions? So to trail on that, so we have roughly 90,000 citizens that are on Medicaid right now in the states, or in Oakland County, and that's what's driving our revenue. But before COVID started, we had about 75,000, roughly. I mean, I'll use rough round numbers. It's easier to do the math. And some number of those folks may stay on, some may get recertified. We don't know, but we know that there will be a drop. Do you guys have a plan at this point? This is probably not an audit question, so you can relax, Jason. But basically, do we have a plan of how we're going to model or estimate what that financial impact will be on revenues for the rest of this fiscal year that we're in? Because the July, August, and September checks that we get. Yeah, go ahead, Dana.
So we've been looking at that formula using lists that we get from the state to tell us when people are due to be redetermined. And so we have an estimate, and so we're still looking at the data to see how we can make sure that we're covering ourselves so that we don't trend too low, so the drop is so far that we can't keep up with service delivery. And we know we will, but we need to know the full impact. And so we're actively working with the community. We're working with the Oakland County Health Department and those places that we don't necessarily serve those individuals, but they're on our roll because they're found to be Medicaid eligible. So we're not serving those individuals, but there are individuals we probably should and need to serve. And so the other way that it will actually happen is that if those individuals are dropped, and I said this, I think, the last time we met, is that if those individuals are dropped from Medicaid, they're eligible now for other programs and supports, like the CCBHCs, the behavioral health homes, and some of the other programs that are out there, so that most of those individuals who don't qualify for Medicaid can get accountable care. They can go to the market, but also, I'm forgetful now because this is cold in my head, sorry. But also, there are other eligible programs, and people don't necessarily qualify for the intensity of services that we provide. So there'll be other programs and opportunities to get them some service and support. And that's why we have to look at how we reimburse for those services and not just throw the money in one pool, just actually pay for those services. This person is Medicaid, it should come out of the Medicaid funding. This person is CCBHCs, it should come out of that bucket. So really balancing that, even if our Medicaid goes down slightly, we have other resources we can use to pay for those services that they qualify for.
Okay, but
I hope I answered your question.
well, you were answering a question on how are you going to support the folks that come off, sort of
Yeah.
like a few years ago we had a soft landing thing that we
Mhm.
did. I think, Melchi, you probably remember when we did that, and
Mhm.
when we lost the mild to moderates, and we had to help them transition over.
Yeah.
So we used reserves then to help make that happen, some of our unreserved funds to
But
help
at that point in time, honestly, we didn't have programs like the CCBHC,
We did.
so that is a true resource that people will have available to them. And so the other part of it is when we're looking at the numbers, and I don't want to give the number from memory, I know that Nasser and his team, Jenny, and other folks on his team, as well as the finance team, we're looking at the dollar amount and the potential number. If it reduces by this amount, it should be this. If it reduces by this amount, it should be that. So I don't have that in front of me, but we can definitely bring that information maybe to the next CAL, so you can see that. And those are predictions. Of course, we don't know true impact, but we know there'll be some impact.
Right.
And so our plan is also to look at how we currently fund and support our providers. And there are a number of different ways we can do that, by tightening our front door and making sure that people are going and being referred to the places they should be referred to. And then also doing utilization management process internally on the, I wouldn't even say the back end, but as a person is receiving those services, to ensure that they're receiving the appropriate amount of services and supports, and that there's no overutilization or underutilization for people who have services identified. So there's a couple of things, not just one, but we're looking at all of that as a comprehensive way to really, I don't want to call it budget deficit, but it is, but I really want to look at funding management, and how we manage those resources that we get in.
Okay, and that makes sense for covering the folks we serve.
Mm-hmm.
And that is very important. We're also concerned about some of the revenue or the reduction in revenue. Even if it's a step down, and it's even 1/12, over each month, or over the whole year, 1/12, reduction of 1/12, 1/12, 1/12, that equates to, simple math, 78, 1/78 of our revenue in July, 2/78 in August, 3/78 in September. So we're going to lose roughly 6/78 of the revenue of this reduction, even just as a swag, and not of the total revenue we have, but if you looked at the difference between being at 90,000 Medicaid lives that provide us revenue and 75,000 lives that provide us revenue.
Mm-hmm.
And so we're just trying to get a sense of what are we going to do about that? What method do we want to use to take an estimate of what this hit is going to be revenue-wise? How do we communicate with the providers to let them know there may be some costing things to do that as well, on the services that they're providing, and as well, how do we communicate that to them? How do we communicate it to the persons we serve? And as well, if that's not the modeling method we're using, the question is are we going to pool our resources with Macomb and with Detroit Wayne, you know, to see what we all collectively think this hit might be to us, because we carry 65% of the lives in the whole state. So, and our numbers guy, well, not our numbers, our analytics guy, you know, is on top of that stuff. I know. He's almost ready to jump. He's a thoroughbred. I don't mean to speak of you like a horse, but Nancy, you're very good at this stuff.
I will use my next chief data officer. I will use my outside voice because they don't have a mic. So hopefully everyone can hear.
There is a mic right here.
We are doing so many things in this aspect. So first of all, the reduction, if it happened in our funding, is not only for the people we serve, for all of the Medicaid eligibles in Oakland County. So we get a list from the state on a monthly basis. They just started the practice for everyone in Oakland County with Medicaid who has a redetermination date during that month. Number one, we bump that against the people we serve, and we extend the information to our providers for the people we serve again so they can work with them and submit applications. That's one. Two, we are working right now. So to be honest, the worst case scenario, which is every single person on this list won't have Medicaid, I'm not assuming that is going to happen, but this is the only scenario we have right now until we pass a couple months. Then we can say, okay, out of 100,000 people, for example, 10,000 people, the percentage was 10%. Then we can give you the predictions down the road month by month. But at this point, the only thing that we can do is the full population, and the number is scary.
But I am concerned because for the next 3 months, we're still part of this fiscal year. And the rest of it is 9 months for the next fiscal year, which is 3/4 of the year.
You are correct.
I just want to make sure that we're being careful, that we're taking, I know we're taking positive action to protect the folks that we serve. I just want to make sure we're protecting our house too in terms of the revenue generation as well, that we have not that much control over.
But I agree with what you said earlier in terms of joining efforts with other counties, because as a matter of fact, I read over the national news, some states are pushing back with the federal government because it's going to cause a lot of problems for them. So hopefully Michigan will join the move as well.
Well, if they do, again, Southeast Michigan, the Tri-County is, 2/3 roughly the lives that are served in the whole state. So if the state is going to make a case with the feds, maybe they need to talk to the Tri-County a little bit more too.
Agree.
Because we'll tell the stories of how it's impacting lives. They'll tell the numbers.
Agree.
Other, Christina.
I just want to make sure I'm understanding the CCBHC data in the audit. So I do see for 2022, the operating revenue for CCBHC was $22 million. What about the expenses? Because I'm just curious, is that equal, or is one higher than the other?
We don't show that right now because that CCBHC expenditure total is rolled up within the Medicaid Health and Development disability total.
Okay.
But if I recall correct, the actual expenditures were higher than the revenue that we brought in.
Which is a shame, because I don't want to see something happen to that program. Doesn't that serve the underinsured and uninsured?
It serves the non-traditional person who does not meet CMH criteria.
Right.
So, and it also serves mild to moderate. The only requirement is that they have a diagnosable condition that we can treat.
Okay.
So it serves uninsured, insured, who
Yeah.
have limited behavioral health and physical health benefits.
Yeah.
So it is a good
It
program.
is. I've referred a couple people, especially because I speak with the Spanish-speaking population,
Mhm.
and sometimes they have no insurance at all, so they definitely don't have the Medicaid and qualify for those programs. So yeah, I just wanted to make sure I was trying to look at the audit data and everything correct. Thank you. Oh, wait, no, one more thing. In this document, only the first page has answers. Is that?
Oh,
Ye-
that's,
Yes, we have a PowerPoint that is following up after our auditors that, Patrick, the, CFO, interim CFO is going to present, that covers the additional questions.
Ask, I'm looking at this. The Net position, end of the year at 61 million, right? And that means that's how we go out? Correct. Okay, so we're not going out with, there's not a deficit or anything like that, so we'll be even based on some numbers that have floated for a while, so that's that. I do like, the future outlook, okay? Where you're gonna focus on 2023 and the things that we need, 2024, at that time to stabilize based on a lot of the dollars that may be lost with Medicaid. And I would hope that, we can really focus on it early on. I think you mentioned the first 3 months, right? So we can get a better feel as to where we are, so that we don't have that up and down. Thank you.
And just a follow-up to your question, you asked how much was the expenses for CCBHC. It was 61 million. We paid out 61 million, and the expenses were 56 million for that service. And also, that's where that late entry came in to make the adjustment for that $5 million adjustment that we talked about in our audit. We overpaid the service.
John, did you have a question?
Yeah, page 15, on the statements of revenues, expenses, changes in fund net position. Under the non-operating, investment return, that's a paper loss of 2.7, right?
That is correct. That is our unrecognized gain and loss that's causing that shift or
Okay.
scary number.
Well, that's part of why I'm raising it. We didn't actually lose it, we just, if we had to liquidate, we lost it, but, okay. And how, have we ever had to use, this is more of a historic question, investment income towards operations? Or is it purely, go ahead, you're ready to answer already.
Okay. Yeah, so you mentioned investment income. Yes, we have had to
Okay.
use investment income. And we purposely we have a policy in place that allows us to draw down investment funds as needed. Because of the fluctuation in fiscal years and funding,
Right.
we put money away into investments, which are probably gaining a greater return on investment, and probably most likely you don't want to hold that much in a liquid bank
Right.
account, so you try to tie it up in a not so liquid investments. And there is a policy which allows us to contract and speak with our investment advisor to let them know, okay, whenever securities mature, don't reinvest until you talk to us first. Because if at one time we were liquidating investments, and sometimes we would need the funds before they tie it up in a long-term security, and we would say, okay, hold it in the money market in investment until further notice, until we let you know it's safe to make an investment.
Okay, very good, thank you.
Yeah. Didn't we use some of our investments to pay off the mortgage on this building, to accelerate that process?
I believe we did
Yeah.
draw down, we
Yeah,
did
it
draw
was-
down some investments.
It was
It
a
is-
higher cost on the
We were
mortgage than it
paying
was
more
the
on the
investment.
mortgage
Yeah.
expense than what the yield was giving us an investment. So we,
Yeah. Yes, Dennis?
Not a question, just a comment. I just want to say, it's always quite an achievement to have what looks, hopefully, like what we would call a clean audit, and with no findings and no reports on any non-compliance. And every year is challenging for different reasons. This one, more revenue coming in, more things to track and follow and make sure they're done right. So, that's a particular, I think, fine achievement, and congratulations to our team. Thank you to BDO, and to our team, you just have to do it again next year.
So normally, this, as part of the audit report, it would be ready, it'd be closed, and we'd be looking for motion to support it. But because you're not done yet, I can't recommend or ask the board if they wanted to tender a motion to approve the audit, because it's not final yet. Yeah. Okay.
And we do not, I mean, we don't.
You wouldn't say
make a
to.
motion to finalize.
I know. Are there other questions? Anyone?
You know, Mr. Chairman.
Yes, sir.
You raised a great, question in relation to using some of the investment fund to pay down the building, and I'm wondering if in your report you could highlight things like that, because I think that's a definite positive, in relation to what you're tracking, because that was a great idea. The cost of the mortgage and that interest far outseated, you know,
Right.
what you were making. So I think it would be a great idea if some of the positives that you all have put in place ought to be similar to what you're saying, the analysis you'll be looking at next year.
Mm-hmm.
So I think that goes well in your audit.
Yes.
And we are still paying the bonds on the other building, which is sort of weird, because those will be done, and we have to renegotiate with this county, because we don't own that building. Right? They could toss us out after 20 years. All right. Did you guys want to bring up your slide and take us through some of those questions? Because I know we covered the questions that Jay's with BDO, but I wasn't sure if we covered all the questions that you had or answers from the other slide.
And I believe we did. Okay. So we want to continue on with the financial software. OCHN transitioned from Microsoft Great Plains to Microsoft Dynamics 365 Business Central, and that was effective October 1, 2022. OCHN's current auditor is BDO. They did receive FY22 financial information directly from our staff, and they did not have access to our system, and that's not common practice. Most auditors will, let you know that very few entities that allow you access to their financial system.
I can tell you the internal auditors at Enron provided to the external auditors at Enron.
Okay.
But they were both Arthur Anderson, so I'll leave it.
Yeah, I know, right? And that's exactly why they don't have access. Okay, go ahead. Yes. Okay. Well, you're welcome to chime in whenever you want. Okay.
I figured you guys needed a good laugh.
All right. And so also, OCHN, the manager of accounting, oversaw our implementation of our new financial software management system. And I know that all of whether the information was ported over from the old financial system to the new one, we ensured that with our accounting manager, who's an expert in that area. So we ensured that all of our account structure was brought over properly to align from the old system into the new system.
Why he's there, it's not just me. I work with a team of accountants, as I mentioned, the cost utilization team. There are several other members that looked at this information to ensure what was transitioned over. So,
and then also because of FY22 financial transitions were performed within Great Plains, the auditors were not required to include the review of the new software system. So next year, they'll be looking at the Business Central software and doing their audit scope based on Business Central and what's in there.
So more taillights than headlights. Okay.
Traditionally, auditors do not have full access to the auditor's financial management system, which we alluded to, but I provided all the audit information and support as requested. Continuation with the financial analysis, OCHN's restricted net position, it decreased from 22.8 million to 19.3 million in FY22. We mentioned that the ISF funds of approximately 7 million were used to cover a portion of OCHN's FY22 Medicaid shortfall. And then the other 3.6 million increase in SUD made up a net decrease of about 3.5 million. OCHN's unrestricted net position decreased by approximately 8 million. Unrestricted funds were used to supplement the Medicaid shortfall. And then OCHN's experienced a decrease within current and other assets due to factors discussed within the financial statements, MD&A. One was the Medicaid, right, holding other cost settlements from FY20 and were paid in 22. So that amount was substantial, part of why our expenses were higher in 22. Also, the Medicaid emergency was still in place, and we were paying reimbursement costs to providers. The cost settlement process was delayed. We mentioned that in order to support providers during the pandemic from FY20 to the end, and ended in May of 2023. So during this time, providers also received stability payments as well. In FY21, provider cost settlements were based on financial status reports, FSRs. And then the core providers and all other providers except VOTE have completely moved back to the service model within FY23. So that net cost reimbursement no longer is in effect. We are going to, based off the not to exceed contract amount and the service models. The core provider expenses from FY21 to FY22 increased by 42.9 million, and two of the providers, which were CCBHC providers, had an increase of 10.2 million for CNS and 14.8 million for Easter Seals.
And if you were to add those totals up, that would get you back to the 68 million increase within that mental health and disability line.
For Easter Seals, is it now fully combined Easter Seals Mork, or are they still kind of functioning financially separate? But
I don't know if they're all of their services are completely combined, and because I'm paying both. We pay Mork and we pay Easter Seals.
That was kind of my question in a nutshell.
If I make one payment, then I can assume that they're one entity. But right now, we're paying services for under MORC, and then we pay payments and cost settlements under Easter Seals.
The other part is there are separate contracts to do transportation, to do the training piece that we're still in contract with Mork for. And so the top part of Easter Seals Mork is combined. when you look at the budgets and the cost of service reimbursements, they're separate. And those other contracts as well.
Tandy, do you think that's gonna change come the new fiscal year because we're renegotiating with everyone?
I'm not sure I can answer that yet. I think a lot of it depends on the, how their merger is completed. That is, I believe, the direction that they're going into, because I don't know if I should say this or not, but the merger is more of Easter Seals incorporating Mork, so that's really what it's gonna be, one entity, and they've already changed their name. I think their boards are combined, so I think the last part of it is really how do we pay for services with one budget for the entire entity. And then there are other services that we want to, that we've delegated to them, and we want to look at how we better manage those internally as well, especially with the issues and concerns we have with transportation. And then we should be complete with our training efforts, because we bought our own learning management system, and that's been 2 years now, I believe. And so eventually those things will be completely internal to our operations.
Right, well, we have the LMS, the learning system.
Yes.
But we'll also have the credentialing that we're slowly growing.
Yes.
For the whole network.
Yes. And the training piece, which Mork is, I mean, they've done an amazing job with their training programs, but there are some parts of their training that are limited to individuals we serve with intellectual and developmental disabilities, and we need a broader array of learning. So it also is capturing the services we provide for other groups.
Okay. And Eddie, you were saying before that the 25 million was really above and beyond what we expected on HBC.
Right.
Okay. Well, hopefully this year we won't be as surprised. Other questions, Christina?
I was looking at the slide, and I don't really see administrative cost listed as something significant for an operating expense, but it seems like it was kind of significantly higher compared to the change between 2020 and 2021. Any comments on that?
Administration expense for core providers expenses?
I don't know.
Or for internal? Oh, internal.
Okay.
Okay, well, we basically, have taken pride in the fact that OCHN has remained within 6% of our overall budget as part of our administration budget. So we still are within that 6% range.
Okay.
However, we did increase our staff by about 135 people.
Oh, wow.
From,
Didn't realize it was that many.
I'm sorry, by 35.
Okay.
35, yeah.
I was gonna say, what?
By 35 people.
Mm-hmm.
From fiscal year 21 to fiscal year 22. We also, just as we try to make sure that providers retain their good talent and staff, our CEO made sure that we gave incentive bonuses for our staff as well to maintain them during COVID and during the pandemic. So those were some of the things that contributed to the increase.
Okay, thank you.
I was trying to get,
Yeah, oh yeah, you have the floor.
no, Dick,
I was
trying to get back, to, from what you showed on the slide, and I'm just going back to a couple of months ago when we were projecting that we had a carryover $8 million deficit, okay?
Okay.
I don't know if you remember that number.
This today?
And, well, you mentioned in this note that $8 million is gone, all right? That was a deficit of.
Come on, from a previous.
Previous year, okay? And this is not a bad negative, this is positive in relation to clearing that. And then I think a couple months ago, we said we may be looking at a $6 million, but we've ended the year, based on the numbers you're saying, at, at $61 million. Mm-hmm. And we're planning, which is good news. The question that I'm asking based on your report today, is did those dollars come from the request? I think we were going to request the county to give us X number of dollars?
No.
Or that was just that based
No.
on cutting back on the operating expenses and all?
I'm not sure I'm following your question that you're asking.
I think I am following your question. I think you're asking, at one report we gave that we were in an $8 million deficit, but since that time, we have, received, funds for overpayment to CCBHCs. We also received a settlement on our direct care worker,
Okay, so
what's it called?
we,
Direct care worker,
we-
something, we
we
also
had,
received
that's it,
funds for,
CCBHC settlement.
yeah.
I'll get the notes.
We overpaid by, which we were talking about, we overpaid by $5 million, and we received that back.
And then we received, was it 3 or 4 million from that direct care worker
I believe
settlement
it's
from the state?
4 million.
But, just a quick question for clarification purposes. So our net position at the beginning of the year was 71,932,000. Net position end of year 61 million. So there was an $8 million, that's where that number comes from, correct?
10.8, yes.
Yeah, so we
We're
are
talking
positive,
about-
but, yep, there is,
He was talking about fiscal year 23.
yeah.
That's what we were. We were talking about fiscal year 23. As
But-
of April, when I presented, we had presented an $8 million projected.
Yeah.
Right.
So we're $8 million less than what we thought we would be, correct? Because we're 71 million, net position beginning of year, 61 million.
We're combining 2 years now.
I'm looking at 2022,
Okay. well,
page 8, bottom, all the way to the left.
So maybe if you talk about it this way, because we ended last year with a basically $10 to $11 million reduction in net position. That ended September 30th at midnight.
Right.
So we started the year with 71, we ended with 61. That's done.
Right.
Yep.
Okay.
Yep. That's 2022.
That was
2022.
2022. Yes, that's correct.
That's the audit piece.
Right.
Right.
So also in that April conversation, when we were badgering you with questions, we were looking at that, which wasn't fully final, or whatever stage
Right.
we're
That
at
was
with the audit.
that was the, budget amendment 2. We projected 8.9,
For this year.
deficit for this year.
Right.
And then when we got our financials for last month presentation, or actually, for April financials, we showed a 2.2 million loss year to date from October 1 to April 30th.
Right.
Through April 30th.
So the part we can't fix is the 71 to 61, that's done.
Right.
The audit. The part we can fix is the 8 down to something less than 8.
Yes, that's
Okay,
correct.
That's, right,
Yeah,
that's
okay.
the, yeah. It would help if we only asked you one series of questions at a time rather than,
It's fine. We can multitask.
And the number that we're at for this year, that could still fluctuate, right? So we're still,
Yeah,
because it was up,
fluctuate.
now it's down,
Yeah, yes,
so,
that's correct.
just to prepare, okay.
But as you said, yes, it could fluctuate, but some of the things I will, just speak that cause some of that fluctuation, which we already have talked about, the CCBAC and how we were accounting for some of the revenues did cause the change in what our loss or increase was for the year. So I don't want to say it can't get to that 8.9, but as we're trending right now, it looks like we're not going to get there. So, but we'll see.
More questions? Any more questions?
I have one really quick.
Sure.
So the issue with the way that we were accounting for this CCBHC, was that because they haven't even fully fleshed it out at the state to let us know what we're supposed to do? Yes. Okay, thanks.
Absolutely, yes.
All
And
right.
now they're even looking at how they reimburse for mild to moderate and how they define that level of care and what the reimbursement rate will be, which is a little scary because based on how they set it up, they took an average of what it costs to serve people who have the most extreme needs and the people who have the low needs, and they came up with an average rate, right? So it's supposed to balance out. So now you have a change in leadership and a change in how they're looking at the CCBHCs, and they're looking at now adding in a different rate for mild to moderate, which really does make sense, but it's gonna make it a little more difficult for, I think, for the providers to do what they need to do. And
Right.
so they're used to getting this higher rate per day, like it's called a PPS1 rate, and it's it's like $400 a day. So if you pay $400 a day for an individual who's mild to moderate and $400 a day for an individual who has high needs, it's really going to be difficult for not to balance that and cover some of the costs that they really couldn't account for because they don't know who the enrollment number and things of that nature. So I'm hoping that they won't break it before they fully get it out and going.
So, since the managed care organizations, the Molinas, Meridians, and whatnot, they cover mild to moderates under Medicaid, couldn't
Yes.
the state take some of the funding from them to offset the CCBHC cost too?
You
Since
know,
they're not providing those services?
I'll try to give you a very professional statement and opinion about that. I think they could have done that a long time ago. And I think that they were responsible for individuals who have mild to moderate mental health needs, and they did not provide the services. So a lot of those individuals who did better could have moved over to the health plans and didn't, because once you were enrolled in community mental health services, it's like once you're in, you're always in. But they weren't really managing that level of care because the rates are so low anyway. Medicaid rates are already low, and then you put on top somebody who's mild to moderate. Makes it really difficult to build a network. And even if they had a network and an agreement with one of our providers, the health plans did, some of the providers would still bill CMH because, one, the rate was better, and two, we pay faster. So they would utilize and use that whole thought process, well, they're already a CMH person now, you need to keep them. So disenrolling people is not the best way to make sure they get into the service array that they need. And I'm not talking into the mic, so it makes it hard.
Last round of questions. Anything? John Paul? Yeah, Mike? Adam? Yvette? Dr. Hahn? Okay. Dennis? John? No one? All right. Thank you, guys.
Well, we still have some.
Oh, you have more? Okay.
Unless you want us to stop.
All right, we'll let you keep going.
You know, there's an old saying, though, you should quit while you're ahead, but I'll let you go.
Contributing factors to expenses included, as we mentioned already, CCBHC, premium pay, network expansion, new providers. Core provider payment methods have not changed. Providers are funded based on not-to-exceed guidelines and service models. FSRs are submitted quarterly by providers. Providers are paid monthly. And then provider funding is based on predetermined set budget amounts. Provider expense aligned with service model dashboards, reported service claims, etc. And then providers are funded 1/12 monthly payment ratio. So when we get those quarterly financials or FSRs, we'll be able to know how in line our providers are with what their 1/12 payments amounts are. And we can look at the quarterlies and review it and know if they're on track to exceed or come within the net not to exceed contract amount, and we'll have be able to make adjustments or have an idea of where we're trending at that time. This specialized residential and CLS services providers submit claims into OCHN. Claims are adjudicated and payments are processed through Business Central. That's one of the cleanest processes to adjudicate claims directly in OCHN. They submit the claims. We pay based on what's in OCHN through our new Business Central software. and I must say that is working well in that regard, because not only do it adjudicate the claims and pay it through our software, Odin and our software is talking directly, and it also helps to do fund management for our payment. So it divides it into what service we're paying for in that payment. So. The next thing we want is core providers contracts, include a not to exceed funding clause. Service expenses cannot exceed the designated amount in a year. And then contracts include a designated percentage for administration expense. They have included in their budgets a 12.5% amount for their admin. And then for service models, expenses are compared to dashboard's earned amounts. If providers earn less, or if they expense less than what the dashboard's amount shows as earned, then they were receiving and will receive a 2% profit. We do have quality management that ensures claim submissions are accurate. They do audits and verify that what's submitted is what's being paid. Claims are also reconciled to ensure that service units provided are acceptable. In FY22 or in FY21, OCHN utilized cost reimbursement to pay providers. We were paying by cost reimbursement, so we paid whatever cost they incurred during the pandemic and the emergency order. In FY22, we moved away. We're going back to the service models for FY23. We also mentioned that providers are submitting their quarterly FSRs. FSRs are reviewed to ensure expenses are Medicaid allowable and to compare expenditure categories. OCHN followed up with providers that submit FSRs outside a typical range, or if a provider has expenses that has annualized projections that are expected to be higher than the budget amount. We mentioned that those FSRs that they submit will be able to reconcile and know if we're trending in the wrong direction, or if our expenses are greater than what we're paying out. That's when we'll kind of have an idea of if there need to be adjustments, or how do we go forward with making sure that there's no overpayment at the end of the year-end cost settlement.
I have a question. So if we're doing all of that, or if that's happening, then how do we end up with those cost settlements?
Well, we mentioned last year we were on a cost reimbursement, and so we paid whatever costs were incurred. And this year we're back on the funding models and not to exceed contracts, so we're holding our providers closer to that contract amount.
Okay, so last year we weren't doing that, this year we are.
That's correct.
All right, thank you.
Can I add a point of clarification too, is that not all providers are on our claims processing. So primarily, they're looking at what's in Odin, right? And we're also looking at what's on the FSR. So the process for verifying is through encounters. In order to make sure we're doing a improved way of processing payments to services, we're going to look at a claim system. So our new system allows us to do that portion of it, but you have to separate. Industry standard says that your claims department is separate from your payment or finance department. And so that's not how we have it set up right now. So our cost analysts are also in finance, or utilization of service analysts are in finance. And really, they should be a part of the claims department that adjudicates claims. It moves us more to a fee-for-service model, but it also allows us to better manage our funding sources. So it sounds complicated, and we're going to come back to you in a more standard presentation of how we're going to move forward. But right now, all of our providers are not submitting claims. They're being reviewed based on encounters and based on FSRs. So you have, like, SUD is claims. Other programs are claims. And then you have, like, our core providers, they're submitting FSRs, and they're submitting encounters through our dashboard system. So we need, like Patrick said earlier, our Business Central to be able to talk to these other systems to ensure that the claims are completely adjudicated and approved for payment. So what was authorized to be provided, either through the IPOS, the Individual Plan of Service, or an actual prior authorized service, is submitted based on a code, and then it's in the system. We look at how much was provided by who, and then we can adjudicate the claim, which says it's okay to pay. It tells finance, go ahead and pay that bill. They did what they were supposed to do.
So if we have contract with them and we have a budget, do we have a budget allotment of monies that we say that they're going to spend this year, we project?
Yes.
For a fiscal year?
Yes.
So I guess how do we end up with a cost settlement then? Is that when they go over? Because wouldn't we budget for that amount, even if knowing that they came up short and they were $5 million short of what services they needed for that year, and then we find out there is this amount out there that we have to pay them, it would still keep us within budget, wouldn't it?
Well, when we cost settle, if they don't provide the level of service that we pay the 1/12 amount for, then they owe in the reimbursement. Then they would OCHN the difference for the underutilization.
Right, but I'm trying to figure out, because all this really sounds good, it sounds like that's on point. But how do we end up in the situation that we did with some of these cost settlements if all that is happening? So I understand that it didn't happen last year, but this year it is, so that makes sense. But what I'm thinking is if we know budgetary-wise how much one of our providers is going to use, that's that number, and it's there, and it's budgeted.
And we use historical information. A lot goes into coming up with that 1/12 amount. It's various services that they provide.
But they can go over, right? And if they do, then that's where that comes in?
Yes.
It could be cost settled either way. Either they underutilize the services that were budgeted.
Right.
And they owe back, they have to pay back one of those, well, it could be a part of every month where they underutilize, right? Or if they exceed services, especially during the last few years during the pandemic, they could request, and it was an informal process of requesting a budget amendment because they knew they were going to exceed their budget amount.
So maybe, you said it was informal process?
Not anymore.
Yeah, because it should be a formal process, yeah.
And so we would look at it, but it was only certain situations that would come, and it should be all of those things that should come forth.
Right.
Yeah.
Right.
And so I think when you talk about a claims process, you're actually tying a cost to a standardized rate. You're creating a standardized rate for all services. So all providers should, if they provide the exact same service by the same level of staff, should be reimbursed at the same rate. And right now, it's not. And a lot of communities operate on different rate schedules, but even the state operates on different rate schedules. So I think, I know the way we should move forward is to standardize rates. So that you have providers, if I provide 5 units of individual therapy, and Ms. Newman provides 5 services of individual therapy, the rate should be the same. Unless, in some cases, like autism, if your credentials are different, then the payment is different. But in most cases, that rate should be standardized. So a lot of that over and under
Yeah.
is built into their plan, and it's also built into the utilization review process, and it's also built into a claims adjudication that leads to finance pay this bill.
Right, yeah, I'm concerned about the over, right, so, okay, thank you.
Yeah.
All right.
I'm wondering, in answer to what you're saying, the new software package, would that help us to better track that and even do projections or trends? In relation to what, my partner's saying here, of somebody who's been under or overpaid?
I think our new software, mainly tracks the financial piece and not the projection. I think that what our new software will do, it will help us with our internal, reporting, and we'll be able to, provide our departments within our organization with real-time information. They'll be able to go in, without the aid of a budget and finance staff, to look at their budgets on any given day in real time and say, my budget to actual, I'm $2 over my budget, I need to scale back. Whereas now they have,
And honestly, I think that's really related more so to administrative costs, right? And how you operate and how you do your business. When it comes to the service part, everybody sort of has this clinical pathway, right? You start off with your screening that says you're eligible for services. Then you go to get an assessment that verifies the level of services that you need. And your plan of services, I'm going to get individual therapy, I'm going to get respite care, I'm going to get a number of different services, which should be tied to a code, which should be tied to a rate, but based on your level of need. And so once that's done, that's a clinical process, right? And so that should be in our system that shows up. And then when a claim is submitted by the provider, says, hey, I use this amount of service for this individual, on the back end, the claims department's going to say, just like hospitals use and other large systems use, claim systems, because you submit encounters, right? You submit claims for payment. Counters only tell you that this was provided. The claims portion tells you the amount that I should be paid for that service. And so once that's done, then the system should tell the finance system, pay that bill. It's okay to pay. Because we verified that all these steps were taken in the process, and they are correct. So Medicaid verification, we only do a sample. But this will almost allow us to do everybody that we are authorizing services for, either formally through something that needs prior authorization, or informally through a crisis service, which doesn't require any prior authorization. So we'll set up the pathway and show you. It's a lot of work, right? And so we have to take it in phases. It's a lot of work to get us to operate as a managed care entity, which really is our true function, is to manage care and not just to pay. Because when you get caught up in just paying a bill and not looking at how clinical services are, or even set up. Because some people, you get an assessment, has to be standardized. You might assess a person one way, I come in and assess them another way, so the person's telling their stories to different people. The story may change, not intentionally, but naturally we forget what I told Jonathan, and I told, especially something personal to us. It's like, oh, I don't feel comfortable sharing that with this person, but I feel very comfortable sharing it with Ms. Christina. So that's all part of it, and standardizing everything that we do. And not to say we've done anything bad all along the way, but this is an opportunity, honestly. That's why I wanted to change this deficit reduction plan to fund management plan, so we can better utilize those resources that we have, and so that the hit, if we get any, we'll get some from the Medicaid redetermination process, is minimalized. Because now we're going to say, okay, you didn't qualify for Medicaid, but here's this other array of programs you may qualify for, so we don't turn you away.
Dana, yes, Dr. Hahn.
mic is not working, but, so Dana, am I, correct to understand that we have, that this system will track utilization as well as the financial track, or, and so currently, how does that work?
Currently,
I mean, in the fiscal 2022, how was it working?
fiscal year 2022, like I said, you have some departments or some areas of service that were fee-for-service that they submitted encounters and claims. So we were able to look at those claims and say, yes, service was provided, pay the provider. And the other services that our core providers do, we get the information through encounters. We don't get claims. So when we go to align those two together, it's much harder to do because, one, some of the rates are varied. The way different providers have different rates, that shouldn't be the case. So we need standardized rates. So I say this is a huge undertaking to move us to it, but we have to, because then we prevent funding situations such as this. We're never going to absolutely get rid of them because of how we're funded, right? The state funds us differently than most industries. So the budget is designed differently for each region of the state. And then you add on the layer of the CMHSP. We're both. So we get different funding through different doors, right? And so this will allow us to better manage those funding sources. So whatever, Medicaid is payer of last resort, and often Medicaid is the first payer. So if somebody is in CCBHC, for example, and it's covered under CCBHC, and they're also Medicaid and CMH services, you're supposed to pull from the CCBHC door first, because that's the service that's reimbursed by that. And our providers have, because it's a higher rate that's standard in our region. So you want to manage that so that we don't overspend on CCBHCs.
Dana, on a similar note with trying to minimize surprises, I think in the last few months, you mentioned that we might be moving to a, instead of quarterly analysis of truing up or cost settlement, to maybe monthly, where we can do, maybe not in the settlement, but at least in the analysis of the burn or of the run rate. Ongoing, yeah. Is that still part of the process change that we're doing this year?
Well, we're getting quarterly reports right now.
Sorry. And in fairness to our providers, we have to give them notice. We can't just change our process and our parts of our contract and surprise, you need to give us this every month. Right. So we have to get them ready. We have to be ready. So we don't want to do anything prematurely, because the other thing is building those relationships with our providers so that we're able, if we need to make a change, we're able to go and sit down and say, okay, this is this, right? Without creating this big mess.
But that's where we're headed for the next fiscal year. Maybe not the one we're in.
Well, to be honest, we've been working on this for years, building those relationships. This piece of it is a lot more challenging because we were monitoring differently. And now we know, it's been a 3-year discovery process. So you can't overturn or change everything at once. But when we see that there's a better way to do things, not that it's bad, but again, I want to emphasize, the team here is amazing. They're so committed to the work that they do and making sure that they're looking at opportunities. And I want to be open so that individuals that are working with SUD Network or individuals that are working with the front end of Access, they know that they can make recommendations, suggestions, ideas, because they're doing the work. Our providers are doing the front end work. So we want to have this open relationship so we can talk about opportunities to improve. Not that it's a failure. I want to emphasize that because it's not fair to the folks who work here for years and years of dedication to say that things are not good. They are good, and we're going to make them better.
because we moved forward, that's about the software and all of that. I think that's a definite positive. And the challenges that, the challenge, I should preach a sermon. The challenges that we're going through is something everybody else is going through as well. So, I think we're on the right track, that's the thing. And I think that everybody's looking, how do we improve it? And how do we sort of manage those, and I guess the best way, I guess, the unpredictables. How do we manage the unpredictables?
Okay. I think we've covered everything that's in my slides and presentations.
Looking to see if there's any other questions or comments. Okay. All right, thank you guys so much.
All right, thank you.
Thank you, Jason, and the BDO group. I'm so used to BDO Seedman, but I know. All right, next on the agenda is, I believe we have, Mr. Hooper, okay. We're talking about the public policy topic for public comment. Sorry, public comment and our policy and practice. There we go.
So good evening, everyone. First of all, thank you for being patient and the robust questions that you asked regarding the financials. It does show your commitment to the organization and to the detail, and it also shows our commitment to making things better in an organization that we believe is excellent through a situation that was difficult and will be better. So I would like to discuss with you a new policy regarding public comment. We have not specifically addressed this previously, so we did not actually have a public comment policy previously. So if you look to your packets, you will see the policy that has been presented. Sorry, for some reason I cannot get it to be the most prominent thing on my screen here. There we go. Okay. We have right now really three different categories of comments. We have comments that come in that are comments that are in person. They're comments that, by their nature, are represented by an individual who is identifiable, and therefore there is oftentimes some medium by which we can respond to their comment. There are comments that come in via the website or the comment page. Those comments can be either identified or unidentified, but they are comments that are not necessarily presented during the meeting. And then we have a third set of comments, which are comments that we can receive during the meeting virtually from someone who is calling in. That person is asked to identify themselves. They may or may not be using a pseudonym in that process. They are asked, however, up till now, they have not been asked to give any response information. So typically what I have instructed our team to do is to take comments that are received which do not provide for a contact that will allow us to respond, and to hold those comments and then write responses and then provide them to you. We have tried reading them in meetings. We have also tried providing them to you separately in person for your review. However, unfortunately, recently we have been receiving comment bombing, which is not an uncommon thing throughout the state. It occurs at various times in various public forums, and for that reason, this policy was proposed. A draft of this policy was prepared by our outside counsel, was presented to the executive committee by our chief legal officer, Kalana Ali. During that meeting, I did attend and heard comments. We have since then made slight revisions at best, and so now you have it before you. The way that the policy actually works is that individuals will be permitted 5 minutes of time. If there were any recommendation that I would make regarding this policy, I would reduce the amount of time that an individual is permitted to give their public comment. I think that 5 minutes is excessive. Other organizations give 2 minutes or 3 minutes at most. This is not a dissertation or an exposition of information that we typically are not aware of. It is a comment. So I would recommend that. However, with respect to individuals who are allowed to participate in public or virtually, there are certain rules of decorum that are expected of those individuals, as are demonstrated here. As it says, OCHN's goal during public comment is to create a comfortable space where people are encouraged to share their important and valued messages with the board members. We are listening, we respect your time in coming to speak to us, and we take your concerns seriously. Then we subsequently request that individuals seek and receive their responses to public comments via the customer service team, which is our current practice and works effectively. And then we add in this the process for individuals who speak publicly. So for individuals who are speaking publicly, we indicate that the decorum for those individuals is that members of the public are asked to refrain from using slander, profanity, or ethnic slurs, engaging in personal attacks against a director or OCHN staff person, or to use obscene or grossly indecent language. This is not something that we have previously had in any policy. However, inserting it into a policy would allow us to, at a point, if a particular comment becomes excessive or what we would consider to be inappropriate or indecent, we could essentially turn off the mic. The person would not be, required to leave the meeting, nor virtually would they be required to leave the meeting. They just would not be allowed to continue with their comment at that time. It does not mean that they would not have a subsequent opportunity to speak in the second round of commenting. However, it would mean that in order to complete their comment time period, they would have to conduct themselves with propriety. That is something that, again, would only be expected as it is expected of you, as it is expected of those of us who work in this environment. This is a public forum. People should communicate in a way that demonstrates respect and decency for the work that we do, and should be conducting themselves in a way that is appropriate for public consumption. This all is actually recorded on the record, so this communication, as well as communications during public comment, will last in perpetuity and will be reviewed, we do not want indecency or inappropriate language to be captured in those records. In addition, if an individual wishes to make a comment but is not present, that person may speak virtually. They are subject to the same limitations on behavior. Again, if they do not come to order while giving their presentation, failure to do so would result in the microphone being shut off. And then lastly, if an individual provides a public comment, but that public comment is provided via our website or our comment page, that information would not be read during the meeting, but it would be provided to each of you prior to the meeting, so that you know that a comment was made and that comment was anonymously provided. As we've discussed during various trainings over the course of the last fiscal year and a portion of this fiscal year, it is critical to understand that there are certain credibility issues associated with individuals who provide anonymous comments, as well as the obvious difficulty in further examining the veracity of the comment or responding to the comment with credible and appropriate information. So for that reason, we would provide you with a comment, but we would not go through the effort that we have done up till now to actually provide a response to that comment. So that is the information that I have regarding the policy. I believe you've all had an opportunity to review it. Do you have any questions? I would be happy to answer or speak to those.
Yes, Dr. Hans.
Yeah, in the public comment especially, I was carefully hearing about the time frame that is provided. Are any accommodations made for people with disability, especially with impairments in expressive language?
We actually do, I believe, have a section that speaks to that. If there is a person who does have, is differently abled and would need some support or assistance in that, I believe we do accommodate them. It says members are asked to pre-register at a link on the meeting notice. Individuals requiring assistance may request reasonable accommodations by contacting the OCHN Board Executive Assistant. Comments or concerns not presented at the meeting may be submitted to the OCHN through the OCHN website. So we do have an accommodation for individuals who are differently abled.
Yes, John.
I would tend to agree with what you said. We are very unique in 5 minutes. Most have moved to 2 minutes, some 3. So that's, I would lean towards the lesser time frame, because they have the chance to come up twice, right?
Yes.
Beginning and end. So yeah, which could be a total of 4 minutes.
Yes. Yes, Mokai.
I'm just curious, how are we going to turn off the mic if a person is running over their time? Is somebody going to go over to the table and turn the mic off? Or is there another way to do it?
Well, for people who are virtual, we could mute their mic. I am not certain. Peter, are you able to turn off any mic in the room?
So in the past, and we can move it forward, we do keep a timer back here, and we notify the board chair to limit the minutes to cut the comment down.
Right.
We can keep that practice, but I mean, we can't obviously mute them, but
Right.
we do keep a timer to notify the board chair back here.
And we've, even in recent months, we've had folks that get up to that point where I let them know that we're a minute away from it, and let him know to wrap it up, and he's got one, and usually they're pretty good about, here in the meeting to, wrapping up their comments.
I
So,
should clarify who's ever running the meeting, so meeting facilitator, so it'd be
Yeah.
either you or Mr. Cowan at the cow. We would have to notify you guys that the minutes are up. Who's ever running.
Right. I wouldn't
So-
expect that there would be any physical intervention in that process.
Yeah.
We would expect people who would be appearing at the mic to deport themselves appropriately, and to respect this body, and to do so in accordance with rules. If we give them 2 minutes, we expect that they would be amenable to completing their comments within that 2-minute period of time.
So what I'd like to do, since there may be a question of modifying it, is solicit a motion from the floor for the policy, a second, then with discussion, we can see if there's a motion to amend the policy to a different time other than 5 minutes, and if there's enough.
I'll move, the adoption of the, public comment policy.
Support.
Thank you.
Could I just make a statement
Well,
about my motion?
please, about your motion.
Yeah, about my motion. I just want to say that the executive committee spent a decent amount of time on this, and I don't want to speak for everybody, but I felt there overall was consensus about this, and I've served on 2 public bodies, and it's highly unusual to have comments read into the record, unless it's on a specific agenda item. I've seen that happen. But typically, and the good thing about this policy is we are totally in compliance with the Open Meetings Act. Everyone who comes here will have an opportunity to be heard or comes on virtually, and we respect that process and that law. So I was very pleased with that. So that's important, and those who show up, so to speak, do get the opportunity to be heard as provided by law. So I think it's always good to have a policy to say what the parameters of the policy are and comments that are made and how we will respond as a body. So I want to thank everybody from the legal staff, yourself, and others who weighed in, and our outside counsel who weighed in on this to give us, I think, a good policy. Thank you.
Thank you.
Okay, so now I will ask if there's anyone who wants to make a request for an amendment, or first of all, I was looking for, because there was some discussion about reducing the amount of time. Okay, so you are? Okay.
I'd like to put forth an amendment to adjust the time down from 5 minutes to 2 minutes.
Is there, 2 minutes, is there a second?
Second.
All right, so now we'll have discussion on that. Are the folks that are wanting to comment on reducing it to 2 minutes, keeping it 5, or something in the middle? Yes, Christina.
Does the Open Meetings Act, does it give a time suggestion, a range or anything, or no?
No, it does not.
Okay. And what did you say the common practice was, 2 or 3 minutes? What's most?
It has been my experience that the common practice is 2 minutes.
Okay.
In order to expedite meetings such as this, it probably is in the best interest that we do that. If there are, for larger venues, for example, where there are county commissioner meetings, or there are meetings of city councils where there are contentious issues, 5 minutes would be exceptional, with 20 or more people making comments. So 2 minutes is more than adequate for someone to make their comment, and for us to take that into consideration.
Okay. I don't know. We've had some people share like very personal, emotional stories. So I feel like I would rather support 3 minutes, but I don't know if that's the majority.
I would also rather support 3 minutes. We don't have a whole lot of comments here typically anyways.
Dr. Haas?
I am just wondering if the Citizen Advisory Committee or RRAC had any input into this?
Not that I'm aware of. I can also tell you from experience here, you know, with the 5 minutes, and we've had that for decades, to put it mildly, at least the 10, 12 years I've been here. On a rare occasion, I think the last time we had it was the other building, where we had a dozen people that wanted to each talk, and they all went to their 5 minutes, and it was on a hot topic. But it's rare when we get that many people that want to, either because of COVID or whatever, there hasn't been that much controversy where they want to, you know, have that many people that want to make public comment that go all the way to 5 minutes. So I'm wondering if it is necessary to actually cut it down for the rare situation where someone goes over 2 or even over 3. Just my thoughts.
But
Yes,
people
sir.
always have the right to put their comments in writing as well.
They do, but think about the population of persons we serve. Some can, some can't.
Right, but we also offer assistance if they ask for that assistance in advance.
Yeah, I'd be in favor of the 3, but I do want to say, I think too, if we do have someone come speak, and because of their particular disability may have some difficulty, I think it's within the discretion of the chair to allow that person to go further and extend their time. So I feel that would be something we would do, or someone can ask for an extension of time for that person. So.
Dr. Hans?
Yeah, since many of the board members were appointed during COVID, but prior to COVID, public comment also gave a format for people that we serve to directly communicate with the board. I think for probably 7 or 8 years, that's what I noticed. And that was a great learning experience for me, in spite of the fact that I personally have a very long history of 45 years with disability, and sometimes quite challenging situations for a family like mine who had all the resources in the world. I have taken my son to Europe, to England, Germany, India, everywhere looking for something that would help him. I think this is appropriate that we limit time for the public comment in the public comment format, but I think we should find more other venues like town halls or other things, other formats that people can directly communicate with the board, because that is very important. That's why I serve on this board. Believe me, 25 hours of my week are spent with my son, taking care of his needs. My husband, 77 years old, still working full time. I don't have any other obligations, but I'm retired. But even people like me can have a stressful day, and I think it's very important that we have some platform for people that we serve to directly communicate with us. Thank you.
So there is if there's no other comment, there is amendment to the motion for 2 minutes. I think we have to.
The first one has to be voted on first.
So,
Could I ask, Melchiah, would you amend your motion to 3 minutes from 2?
it's going to cost you. She said, yeah.
Okay, all right.
All right, so now we're at 3. Thank you. Is All right, so we need to we'll do a voice vote on this for the amendment. All those in favor of modifying the proposed policy to change from 5 minutes to 3 minutes, say aye.
Aye.
Any opposed? The motion carries for the amendment. So now, is there any further discussion that people would like to have on the policy with the 3-minute time limit? Not hearing any, I think we need a roll call to approve this policy. When you're ready.
Mr. Young?
Yes.
Mr. Furman?
Yes.
Mr. Cowan? Mr. Torres? Dr. Hans?
Yes.
Ms. Newman?
Yes.
Ms. Root?
Yes.
Ms. May?
Yes.
Ms. Woodruff?
Yes.
Dr. Giles?
Yes.
Pastor Jones?
Yes.
Mr. Lambsman?
No.
Motion carries.
Thank you.
Great.
I just wanted to ask, this policy gonna be posted on our website?
Yes. And I believe there's a modification to the language that will be posted on our notices as well.
On the statement that's attached here. Yep.
And on the form that people can complete if they go online as well.
Correct,
Might have to be
removing the,
The anonymous.
the anonymous, yes.
Okay. And for the record, I voted no because I did really think the 5 minutes we rarely cost over, and I do like to hear public feedback, and I think every chair likes that. So, but I am in favor of having a policy.
All right, thank you very much.
It's up on the wall. Okay. Next item on the agenda is our consent agenda. It's for items that will not have discussion. I need a motion to approve the consent agenda.
Move for approval.
Thank you.
Support.
Thank you. Roll call vote. All those in favor? We don't need a roll call? Okay, then we'll go voice. All those in favor of the consent agenda say aye.
Aye.
Any opposed? Motion carries. Next is other business. So we have committee assignments, and we have 2 relatively new board members. So Sheila, do you know how many people are on the policy and how many are in finance? Okay,
So you have one open seat on each.
we do. Okay. So Dr. Giles, I got it right the second time. Thank you. Dr. Giles, you are the more senior of the 2 new board members. So you have a choice of being on the finance committee or on the policy committee.
Is it possible for me to allow Pastor Jones to make the choice, and I'll go wherever he doesn't want
If
to?
you'd like to defer, that's your prerogative.
I will do that.
Pastor Jones,
God.
as the junior but now yielded, you have the opportunity to choose which committee you would like to be on.
I'd like to be on the finance committee.
All right. Okay, with that in mind, then, Dr. Giles, you're going to be on the policy.
Thank you for yielding to me. Thank you.
All right. Just for those that know, in October, we will have board chair and other reassignment opportunities, as well as the chance to shuffle from, if there's an opening, from one committee to the other. So that all happens during our October board meeting. Okay, next on the agenda are board reports. Is there Melchiah or Dr. Hans? Do either of you wish to read your report, or is it fine just filing tonight, given the lateness of the hour? All right. Melchiah? Okay. Then we'll move on from board reports to our director's report. Dana Lassen. Was there an oversight this month? I didn't think so.
It was in April.
Quarterly. Yeah.
Okay, good evening again. June is Men's Health Month, so we're doing a lot of looking at men's health that includes mental health. And in fact, I've been invited to serve on a panel specifically related to men's mental health by the American Psychiatric Association. So that'll be in July, and that's part of our contribution to men's health. Also, I'm really got good feedback from our report format, and I think it really tells a better story about what we do. And so just to go over really, really quickly the number in access team, we're continuing to work with our access team and support them and how they do what they do, because they are our front door, and we want to make sure that they have all the training and support and tools they need. So this year to date, we've served over 4,000 people through the access. The justice team has been requested to provide a cost estimate for providing medication when people leave the jails, which is really critical so we don't see recidivism and return to jails, and we can really engage people in services. So more information is coming on that. I'm really proud of our training team. We've actually trained, we had 15 trainings in May, and we trained 534 people, and that is a big accomplishment. And even with our CIT, which is in the next portion, the training team did a 40-hour CIT training. Now we have over 1,000 officers or law enforcement representatives trained in crisis intervention training teams. So we actually also had, and it's not in my report, I should have added it, we had a group from New York who's coming to, in part of Wayne State, coming to research and look at our outcomes through our CIT and our co-responder programs. And they gave us a great compliment saying we're going to be a hard program to follow as they seek out and serve and look at other programs across the state and do the research. So they're actually doing videos as they're doing the training with real actors and everything who are playing in these scenarios and exercises with the officers that are being trained. So a lot of great feedback in that area. Still have some challenges with our residential service providers in terms of needing more providers, but part of the challenge is the staffing, of course, having enough staffing to support individuals who are living in residential programs and receiving those community living services. So I actually met with the Provider Alliance group, and we talked about some priorities that they have and how we can align with our priorities and address some of the needs. And the number one thing, and I'm still surprised from the feedback from the survey we have, is, of course, transportation. So getting them involved and engaging in that group so we can talk about ideas to improve transportation. And we haven't heard back from the county yet, so still waiting to be engaged in that talk and planning as well. We, of course, had added on, I think it was 5 SED programs to provide services, and we have one provider who was actually certified to do the home-based services, so they're starting to take in referrals now. I'm really pushing to get the providers that have been selected through this process going as quickly as possible. We appreciate when providers come to us and they tell us they're at capacity, because at some point that does impact the delivery of services. When you have more people to serve than you have available staff to provide those services. So that's something we're closely monitoring. And through the SED waiver program, or SED services, we've already served 1,900 families. So that's important to note, but we know that number continues to increase. As much as we educate the community, of course our hope is that people who are in need do come to us, but we also have to have our providers have the capacity to provide the services that the people need. Let's see, what else? We participate in 28 community events, and our mental health, our school mental health navigators had 7 outreach programs that they were engaged in. We have had a lot of requests from the state, the Michigan Department of Health and Human Services, legislators, and just other insurers wanting to see our YFCC, the Youth and Family Crisis or Care Connection Center, which is good because our hope is that if we show what we're doing, we can expand those services to other areas because there is such a great need to serve children and families in the community. We also highlighted our program on, I actually did an interview with Amy Andrews from Fox 2 News, and so got a lot of good feedback because a lot of people don't even know that program exists right now. So educating the community on that. Of course, our hospital liaisons, we increased the number of hospital liaisons, but we actually were able to support 13 individuals who are waiting in area emergency rooms, getting them moved out of the emergency room to the service level that they require, either inpatient or some other diversion level of care. We have increased admissions to our opiate health homes and our SUD health homes, and our behavioral health homes. So you'll see that in my report. And again, really good for the collecting data and having our systems talk to each other. We have our social determinant of health screening that is now embedded in our software that we have. So our staff can begin to use that on August 7th. So we'll be getting more data to better tell our stories, to better see outcomes and things of that nature. So that's all I have. And any questions?
Yeah, John.
A question about comment. We'll note on transportation that I am seeing a lot more of the flex vans, so keep the pressure up on our county exec office.
Yeah.
It's shifting from those mass buses to the ones that are gonna make a difference for our people.
Yeah. The other thing is I met with the director of SMART in Mackinac, and so there's a relationship there, and they're very interested in working with us to identify that on-demand transportation, which is an option. We need options for people. So if they can't go one way, there are other opportunities for them to get to where they need. And not just for medical appointments. We know socialization is very important for all of us. So making sure that people can go places that they can't usually go because they're dependent on one form of transportation. So working on that as well.
And this is probably already in place, but, and I've been here now, 2 months maybe? And I tell you, the work that you guys do, or the work that OCHN does is just unbelievable. It's just exceptional. And I've had the opportunity over the last year or two now to work with some of the employees of OCHN. Do we recognize them in a special meeting or something, or have them come before the board and we stand up and applaud them? Because some of them have given so much of themselves and in achieving the outreach that we're trying to do, services. I'm just wondering what that recognition program is.
You know, we do a couple of things, and a lot of things are internal. We do applause, so we recognize each other. We also do recognition of service excellence, and that actually is a form of financial reward for services and supports people that go over and beyond. And so that's a nomination of your peers, right? And so in terms of, we do annual volunteers recognition. We do a number of different, we just had a picnic that I missed because I was sick, and I was a little disappointed in that. But we do a lot of that, and I think that shows in, you know, staff's morale. And then also we need to address some other needs. People have different situations that we try to accommodate for in terms of if you work on a Saturday, then you take some time off during the week. And actually, we see a lot more people wanting to be involved in things. And I know initially it was this like coming out of the, I think we're still a part of the pandemic, but coming out of it a little more and coming back, we see folks that are still engaging in the community and showing up. So we recognize them in reports and things of that. But I think it would be amazing. I love the idea of having them come here and we acknowledge them here.
I just
like
think
that
that would
idea a
add a
lot.
little flavor to that, for the commitment and dedication that they have and that they do. It's just something to think about.
You know, we could even display the people who we recognize for years of service and also for those excellence awards because, you know, the board meetings are at night and they're not as brave as all of us sometimes. But if they know they're being recognized, I think they'll show up for sure. Or at least we can display or virtually participate. I think we should provide that opportunity.
Thanks, Jeff. Thank you.
Other comments or questions? All right. This is our second opportunity for public comment. If there's anyone who's interested, they'll have 3 minutes to make a public comment.
We
Is there
did have
anyone
an
online?
sorry about that. We did have an individual that submitted a form to fill out to speak to their public comment. They stated that they would like to read their own public comment. Just a reminder, we do a lot now. Each individual, 3 minutes to share their statement. Individuals who provide public comment are asked to discuss OCHN business, legislative matters, and MDHHS advocacy issues only. We also request that you refrain from using slander, profanity, and ethnic slurs. The individual that submitted for public comment is Deckard Kane. If you are on the call, please unmute and state your public comment. I do not see a Deckard Kane in our attendance list. Is there anyone else on the virtual call that would like to have a public comment?
Hearing none, we'll close public comment. Now we'll go to board member comment. And Sarah May.
I think mine is more of two questions. Are we having some sort of IT issue with board member emails being able to sign on to the Microsoft Teams meeting? I'm unable to sign in, like, through my account. A few of us were unable to, but also I did sign in through my own personal account, and the chat is off. I was wondering, there's no chat available. I mean, I can see it on yours, but I tried it. I'll ask. As long as it's actually turned on, then that answers my question.
Yeah, I will state that I see the chat, and we did have some chats come through earlier in the meeting, none recently.
Okay, great, thank you.
Say to, Sarah May leaned over and I tried to open up the Teams. It would not open up on the iPad. And then on my phone, I was not being admitted into the Teams room. Like, how long ago was that? 5 or 10 minutes ago?
It was when we were discussing the open comment or the public comment timing.
Yeah.
Yes, Dr. P just stated that the chat is functional, and I will state that we have no lobby set on this meeting.
Yeah, maybe
Right.
there's some sort of technical difficulty going on.
And Sheila, can you send a note through Boardable so it hits folks' personal emails? So what the process is that they can do if they need to get technical support, like do a ticket?
Yeah, that's it. Hold on, I put on. I gotta mute myself. Anybody can contact me at any time. I can submit a ticket on your behalf. But,
That's fine too.
I just want to clarify on, you're not able to enter a chat, or you're not able to get on the Teams app?
So I'm not able to get on the Teams meeting through the OCHN iPad, which works through my OCHN email. So like, say I wasn't here, I wouldn't be able to get into the meeting. I am able to sign up on my personal Teams account and get into the meeting, but chat is like blanked out, as in who, typically when I see that, it's the administrator has when they're creating the meeting, they turn off the chat.
So,
but I
I'm
can see on
administrator.
yours that chat is there, so.
Yeah, and I'm the administrator of it,
Okay.
so she wouldn't be able to, you know what I mean? So
Yeah,
Dr. Posey,
no.
so I don't know.
It was just a question. Maybe there's some sort of IT issue.
Yeah, it sounds like it. Okay.
So,
We'll submit
but
the ticket.
at the minimum, let's take it offline.
And to answer your
Sure.
question,
Yeah.
you can set Boardable's personal, you would have to set that, a notification going to whatever email you want.
But
So if you need to walk through that, I can help anybody walk through that.
Okay, so to say it a different way, you know, we know that our OCHN Outlook doesn't forward. However, if there's a message that hits Boardable, if you've set up in Boardable your personal email as well, it will forward that message to your personal
No,
email?
I have that.
Okay.
My,
That
my
was-
that was
issue
their
was,
question. I
no,
think it
not
was
at all.
Teams chat.
My
right?
issue was just, I was worried that for some reason, we weren't able to log in through OCHN. But then also, that chat is super important to people who are, because honestly, they can share information and get in contact with each other for like, even just companionship, because they're all here for the same reason. So it's, that chat's important. I want to make sure it's there.
Right, and my point before was just because I'm used to either reaching out to Sheila all the time or sending a help desk ticket. There's a way to do that, and I just, you know, for people to know if they have a technical, board members, if you have a technical problem, who to go or how to get it resolved, that's all. Yes, go ahead.
I think the biggest thing I hear from you, Ms. May, is that if you can't get in and access chat, then that means other people are, probably have difficulty getting in and accessing chat. So we need to make sure it not only works for our board members, but the community at large. So, just making sure that that's happening, because they may not even know how to ask for help. You're sitting here, we got Sheila, which is amazing, we got our IT team, but we need to make sure that individuals from the community can access our board meetings.
Because Christina just said it let her in just fine now, so I think that maybe there was just a glitch going on.
But these are old iPads. I mean, oh, well then you got a brand new phone, so never mind. But the iPads are old. I mean, that, we know like with Docebo, it's easier to do it on your computer, so.
You gotta find what works.
Pardon?
You gotta find what works.
On occasion, you have to reboot an iPad, just like you have to
These
reboot
jalopies,
your cell
it's like
phone.
every time you use.
My wife's got a really old one that doesn't even have the firepower. Okay, so, and it still works too. All right, other board member comments?
Oh, did it go around?
Well, I was looking for hands that had it, and then I would ask everyone else. So, John?
So he left already, though, we went long enough. I just wanted to say thanks to Patrick. I mean, we put him through a lot, and this has been a difficult stretch, so I appreciate his thoroughness and openness and candor about sorting out the numbers that overlap. I think it's starting to make a whole lot more sense to a lot of people. So I appreciate his energy and clarity.
And I'll plug that there's BoardWorks to help us understand fund sources and other things too, just to look at that additional training. Okay. Others that would like to make comment? Okay. Adam? Yeah.
Again, I just want to make a overall statement. Thanks to the finance team and putting together that report, as well as Bernard's discussion of the public comment. Thanks.
And for others that didn't raise their hand, Dr. Giles. Pastor. Comments? Tonight? Comments?
Well, I have a comment.
Okay.
I'd just like to thank this board for welcoming me here. The openness and just the reception has been exceptional. I really appreciate it, and I look forward to working with you all over the years. So thanks a lot for welcoming me, the invite, and just seeing what you all do. Thank you.
Okay. Any others? All right. I'd like to thank the staff and others that were here tonight to help give us guidance and the support, and those that do it in the background. So the staff that works under the C levels that do a great job. So thank you all, and Dana, thank you and your team for doing all this and for helping the person served. And with that, I think we're in adjournment.